Hi, I'm here with Karen Kibler, Dr. Karen Kibler, who is a virologist, and she's going to answer some of my questions about the coronavirus. So thank you for being here and being with us. So the first question is, how contagious is it?
Well, it is more contagious than our seasonal flu. It is not as contagious as measles, but this virus is unusual because usually when a virus makes a jump from animals to humans, it has a lot of trouble transmitting from human to human because it's a new host and it doesn't have the capacity to do that. But this one has proven to be very good at it. It does transmit very easily.
So who is at risk?
Well, there are a number of groups. First of all, those of us who are over 60, and I would guess that with each decade the risk gets higher. There are many health conditions that create a risk, such as heart disease, diabetes, chronic lung problems, and then anyone who's immune compromised. And this would include people who are undergoing chemotherapy, or people who've had an organ transplant, people who are HIV positive, or someone who has some type of immune deficiency.
Okay. So how long does the virus live? In the air, on hard surfaces?
That's a really hard one to nail down, but I did recently read a publication by the National Institutes of Health, who I trust as a source, that said in the air, probably the virus survives for 2 to 3 hours, and then on some surfaces, maybe 24 hours, but on plastic and metal, up to 3 days. It's really hard to measure because it depends a lot on how much of the virus gets expelled from the patient who's infected. Viruses don't like to dry out, so it's important that they stay moist.
So how do we stay safe?
The first thing is stay away from sick people. That's the most important thing. Then the most common way that we can spread the infection is by droplets from a cough or a sneeze. So, and that's actually when the person is able to inhale it, that's how they get it from someone who's coughing or sneezing. And it does kind of hang around in the air, like we said, for 2 or 3 hours, so you can actually inhale it later also. We can get it from surfaces where those droplets have landed and where it is surviving. And it's not that it's going to infect our hands, of course, but we are all very guilty of touching our faces. And so if that virus finds its way to a mucous membrane, that's where it likes to live, and that's how it infects us. We can also use social distancing and just trying to stay away from each other. That's a good method.
So what if we have it? What should we do?
Call your doctor. When you call your doctor, you may be told to just stay at home and watch for specific symptoms, maybe a fever of a certain level. But your doctor will know what is best and will know if you need to be tested, and he or she will be the one to give you the advice on that.
So how does this compare to the flu?
Well, there are a number of factors you can compare. As I said, it does transmit more easily than the flu. It has a much higher mortality rate than our seasonal flu does. And we don't have any immunity to this coronavirus. We do become infected with other coronaviruses. It's a cause of the common cold. So we have seen coronaviruses before, but they are very different from this one. This is a very different strain. So none of us have any immunity to it. And that's very different from the flu because most of us have either had the flu or had a mild case that maybe we didn't realize was the flu. We've been vaccinated, hopefully, every year for many, many years. So we have a lot of immunity even when the strain changes during a season. That gives us partial immunity so we don't get as sick with it. But we have nothing like that with this coronavirus.
Can I catch it from my dog?
I hear that question a lot. The concern was never so much that you might catch it from your dog as that you might give it to your dog. Dogs do become infected with coronaviruses also. It's called kennel cough. But again, that's a very different strain. It's not like this one. And there are no documented cases of this coronavirus transmitting either from a human to a dog or from a dog to a human.
Are we close to finding a vaccine or a cure?
Well, could you define close?
You defined close.
Yeah, so a treatment for a virus is very difficult. It often is hard on the body because unlike bacteria, viruses live inside our own cells. So to kill the virus, you have to kill the cell, which makes it kind of toxic to you. So it's really hard to have good, effective, and safe treatments for viruses. Vaccines are the best way for us to combat viruses, and it takes quite a while, I would say 6 months to a year, and there are many, many, many groups around the world working on a vaccine. The vaccine candidate, in whatever form it's taking, has to be built, it has to be constructed, it doesn't exist right now. That takes a while. Then it has to be tested pretty extensively for safety. We don't want to vaccinate someone and hurt them with the vaccination. And then it has to be tested to make sure it's worth it. You know, does it actually work? Is it effective against what we're trying to protect the person from? So it does take a long time.
Okay. Will taking vitamins help with our...
Well, I would say being healthy will help. It helps boost your immune system. But I would always use a doctor's or a pharmacist's advice on taking vitamins because some vitamins can actually be harmful if you take too much volume of it, too much of it. So it's better to get some advice on which vitamins will help you most and which ones you probably don't need.
So where can I get the most reliable, up-to-date information?
That is an easy question to answer. The most reliable source is cdc.gov. The Centers for Disease Control and Prevention are the people who have boots on the ground. They deal with all kinds of infectious diseases. They combat all the outbreaks from Ebola to flu, and they are the ones who have the most information, and it's accurate.
So you, who is a Christian and who is Lutheran, how do you live with these realities and yet remain hopeful?
Well, I was thinking about this the other day. You know, our parents and our grandparents learned to self-isolate long before we had ever heard that phrase. When someone got scarlet fever, for instance, they didn't have antibiotics. That was not a tool that was available to them. So the family isolated themselves in their home. They didn't go out, they didn't meet with other people, and so they were socially isolating themselves, and they were doing that to protect their neighbors. So this has been a very difficult time for all of us, and having to miss events, including church services and committee meetings and choir practice, this is really hard for us. So, and I do understand and can relate to the very real spiritual need to be within the walls of a church. We didn't talk about flattening the curve, and that's one of the things that will make a difference. Social distancing helps us to keep the number of cases from spiking into a huge peak. If you think of a graph and a line on a graph, and you're tracking the number of cases every Monday, for instance, and if that goes along between 20 and 100 for a month or so, that's probably manageable. But if it suddenly spikes up to 1,000, that is a huge burden on our healthcare system. We just don't have enough places to treat all the people who need that help. And I don't know if you have ever experienced this. I've had a family member go to the emergency room, need to be admitted, but we had to wait for hours and hours for a bed to be available. And that's when there's not a pandemic. So you can imagine what it's like if we have to overburden them and flood the hospitals with people who are sick, the way we've been flooding the grocery stores with people who want to stock up on things. So I think that if we can really do a good job with social distancing, I think it may be over a lot sooner than if we can't do a good job.
Thank you, Dr. Kibler, for your time and for the information.
You're very welcome.